I am Deepak Singh. I am the Managing Director in Chinchpada Christian Hospital and have been there for the last 10 years. Chinchpada is probably one of the most remote locations in India. Most of the people are among the lowest socioeconomic status people in our region. 72%, according to the 2011 census, live below the poverty line, earn less than $2 a day. The government provides free healthcare, but the government system, because of our population, is overwhelmed. And so, even though the government facilities are available, they might not be accessible. At the same time, we have the facilities which are privately run, which are very expensive and probably out of reach for at least 70 to 80% of our population. And therefore, we as mission hospitals or secondary level hospitals bridge the gap between what the government hospitals cannot deliver and which is out of reach of the general population. We are a country of 1.5 billion and we actually serve close to 20 million people in that population across EHA locations. We have the policy of not turning away anybody who comes to our doors, whether it be the poorest of the people or it be the most affluent of people. Our whole premise has been to provide low cost, good quality healthcare. We don't want to reinvent the wheel, and even if we are specialists, we try and work as generalists to address day-to-day problems in people's lives, but at the same time also perform high-end, very intense and very skill requiring procedures, and that we do by way of having a very good critical care unit and also having a good operation theatre and operation theatre staff. Our biggest challenge is people. It's very hard to attract people to leave their very lucrative careers and come to village India and serve people who are underserved, maybe at probably 1/10 of what they would actually earn in these cities. Oftentimes we find ourselves in the red and wondering how we are going to survive this month. So we would like to build a base of people who would actually be able to come and work along with us in these places for medium term, long term, and even sometimes lifelong. It's not like we requires only doctors and nurses. Yes, that is the biggest demand, but we also need people who are skilled in the lab, skilled in finance, people who can do electrical work, people who are architects, people who can help with our garden and grounds. Other ways which people can help us is we would most welcome your donations in cash and in kind. When we started off in Chinchpada, there was no people, there was no buildings, there was no finances, there was no patients. Presently, what we have is a huge spectrum of patients, both medical, pediatrics, surgical. We are now have probably world-class equipment, the standard equipment needed for diagnostics and also for treatment in any place, anywhere in the world. In EHA, we are just 19 hospitals, but we would like to grow to about 100 hospitals in the next 20 years, which are remote and which can actually give people the healthcare that they need. What we have seen is over the years that individuals have supported us and have been so regular in giving for us in so many ways. And we really want to thank each one of them who have stood by us on this journey.